This is a lecture of anatomy of the hippocampus and limbic system. The study, MRI studies I'm showing today is the images performed with 3.0 Tesla MRI scanner, and the MRI sequences and parameters are showing in this slide. The limbic lobe is corresponding couple of structures, including subcallosal cingulate and parahippocampal gyri, and also hippocampal formation and dentate gyrus. The limbic system is formed of the limbic lobe and the subcortical associated nuclei. And those subcortical associated nuclei includes amygdaloid complex, septal nuclei, hypothalamic nuclei, and the various parts of the thalamic nuclei and basal ganglia. And this network is called circuit of Papez. The molecular biology distinct phenotype for limbic system is associated membrane protein, or LAMP. This is the anatomical section of showing the limbic lobes. So in this the anatomical section, the view from the bottom, you can see the piriform cortex, where the surface of the uncus, and parahippocampal gyrus posteriorly. The most anterior portion of the parahippocampal gyrus is called entorhinal cortex. Entorhinal cortex is located medial to the rhinal sulcus. The rhinal sulcus is the most anterior portion of the collateral sulcus. So this is part of the limbic lobes. In sagittal view, you can see the corpus callosum, and surrounding the corpus callosum, this is the cingulate gyrus. And the medial portion of the third ventricle, there is the septal region and hypothalamic nuclei. In coronal view, here is the corpus callosum. You can see the cingulate gyrus above, and here is the medial temporal region. There is a parahippocampal gyrus and the hippocampus. The hippocampus and limbic structures has connected by white matter fibers in the fornix. So the hippocampus informations followed by the fimbria, and posteriorly fimbria became thickened and becomes a fornix, and this fornix goes around the thalamus and then coming down to the mammillary body. Between right and left fornix, you can see the hippocampal commissura, or commissura fornices. This is a commissura structures communicating the right and left fornix. Above the hippocampal commissura, or commissura fornices, you have a corpus callosum. Above the corpus callosum, you have a cingulate gyrus. If you look at the hippocampal structure, the view from above, you can see the Ammon's horn, or corona ammonis, of the head, body, and tail portion. And then you can also see the fornix coming up medially. The amygdala is located anterior portion of the head of the hippocampus. And here is the hippocampus, and fimbria is a white matter structures and connecting to the fornix. And then fornix come down to the mammillary body. And this is the hippocampal commissura. If you look at the MRI in axial planes, you can see nicely the head, body, and tail portion of the hippocampus. and anterior to the head, here is the uncus, and then within the uncus there is amygdala nucleus. In sagittal section, you can see the portion of the uncus and rhinal sulcus and entorhinal cortex, and here is a parahippocampal gyrus. The hippocampus is located posterior to this uncal structure, which contains amygdala, and then follows the temporal horn of the lateral ventricle. This is a sagittal image of the lateral temporal horn of the lateral ventricle. Within the temporal horn of the lateral ventricle, you can see the elongated structure, which is the hippocampus. If you compare these pictures from the Henri Duvernois drawing, you can see nicely the structures demonstrated here. Also in the MRI, showing the dentated gyrus and column ammonis and hippocampus, including column ammonis inferiorly and superiorly gyrus dentatus. This is a different section of the sagittal image showing the hippocampal structure located in the lateral ventricle, temporal horn of the lateral ventricle, and this is located above the parahippocampal gyrus. You can see the collateral sulcus, and below the collateral sulcus, this is the fusiform gyrus. And usually nicely see the hippocampal structures with column ammonis within the temporal horn of the lateral ventricle. Let's move on to the coronal section. When you look at the coronal section of the hippocampus, there are two fissures you have to understand. One is a choroidal fissure, which is close to the choroid plexus, and this is between the fimbria and the most superior portion of the hippocampus. The hippocampal fissure is the fissure below. This is the fissure between parahippocampal gyrus and the hippocampus. And then you can see the hippocampal structure here. Here is a fimbria, and the choroid plexus is located medial lateral, superior lateral portion of the fimbria, and then this is the temporal horn of the lateral ventricle. In coronal study, there is other structures surrounding the hippocampus. The one is the caudate tail. This is usually seen, well seen in this proton density images lateral to the hippocampal body. Immediately, you can see the big phloboid structures. This is a posterior cerebral artery. This is a T1 images. This shows nicely the parahippocampal gyrus, collateral sulcus, and fusiform gyrus. And again, you can identify the caudate tail, and in the posterior portion of the thalamus, sometimes you can identify the lateral geniculate body. In the hippocampus, the three components of the hippocampal formations are Ammon's horn, the dentate gyrus, and the subiculum. The subiculum is the part of the parahippocampal gyrus and forming the table of the hippocampus. And at the end of the subiculum, there is Ammon's horn starts to form, and then this is received by dentate gyrus. you can see this MRI study that parahippocampal gyrus, and the superior portion of the parahippocampal gyrus is the subiculum, and it turns around, which is the Ammon's horn, and received by dentate gyrus. The surface of the Ammon's horn is covered by white matter dark fibers called alveolus. This is from Henri Duvernoir's drawing of the hippocampus, head, body, and tail. You can see the Ammon's horn, dentate gyrus, the different configuration of the head to tail. Especially the head portion has multiple invaginations, and in the body to tail portion has more simple way of round structures as Ammon's horn and dentate gyrus. Here is a hippocampal head. You can see the multiple invagination of the cortical structures. You can also see the caudate tail laterally, and this is the superior portion of this caudate, superior portion of the hippocampal head. This is the cortical nucleus of the amygdala. Again, you can see the subiculum. Hippocampal body portion, you can nicely see again the subiculum, corona ammonis, and the dentate gyrus, and the superior surface of the white matter called alveolus, and the thickened structures of the white matter is called sphimbria. This is the most posterior portion of the hippocampal tail. You can see the subiculum and corona ammonis just below the splenium of the corpus callosum, and this MRI nicely represents subiculum and corona ammonis just below the splenium of the corpus callosum. The site architecture of the hippocampus is the cortex from the parahippocampal gyrus to the gyrus dentatus shows a transition from 6 layers of the gray matter to the 3 layers. And the pyramidal layer is characteristic in the hippocampal level, and basal or apical dendrites of the pyramidal cells enter adjacent layers, while axons pass through the stratum oriens to form the alveolus. The cortical layers at the hippocampal level are polymorphic layers, which are called the stratum oriens, and pyramidal layers, which is a stratum pyramidal, a molecular layer with stratum radiatus, stratum lacunosum, and stratum moleculare. The hippocampal formation, according to Lorenzo de No, is divided in 4 groups, which is called CA1, 2, 3, and 4, which is shown here. At the end of the subiculum, you can see the CA1, 2, and 3, and then 4. Dentate gyrus also has 3 layers. The major inputs from entorhinal cortex, Brodmann number 28, follow the perforant or alveolar pathway. The perforant pathway is a complex pathway through the subiculum to terminate the molecular layer of dentate gyrus. Inside the hippocampus, there is existence of loop from dentate gyrus to CA3, then to CA1, and then to subiculum, and then ending up in the entorhinal cortex, and then through the perforant pathway and back to the gyrus dentatus, or from the entorhinal cortex through the alveolar pathway and enter the hippocampus again. So those are the complicated intrinsic hippocampal connections. Afferent connection of the hippocampus, they are through the amygdala or dorsally through the pharynx. That you can see the connection from the thalamus, from the medial thalamic nuclei, connected to the cerebellum and the entorhinal cortex. And also there is afferent connections from the stria terminalis, passing through the amygdala and then coming back to the hippocampus. The neural activity of the hippocampus is also moderated by the ventral tegmental area, which includes nuclei of raphe or locus coeruleus. And this pathway end up in anterior hypothalamus and then passing through the stria terminalis and then reached back to the hippocampus. The major afferent connection of the hippocampus includes the stria terminalis and the pharynx. The connection of the hippocampus given by the axons of the pyramidal cell and the cerebellar cortex is converged to the fimbria, and then the fimbria becomes the pharynx with true crura connected by the hippocampal commissure. And this efferent pathway from the hippocampus through the pharynx is ending up in the region of the mammary body. There are anterior column, which is also from the pharynx, ending up in the region of the hypothalamus. The posterior column of the fibers converge to the mammary body, and the lateral septal nuclei and lateral dorsal thalamic nuclei. This is to show the hippocampal efferent through the pharynx and going posterior to the anterior commissure and ending up in the mammillary body. You can see the pharynx coming down to the mammillary body visualized by the coronal scans. This is the drawing showing the pharynx coming down to the mammillary body and the mammillothalamic tract going from the mammillary body to the anterior nuclei of the thalamus. And from the anterior nuclei of the thalamus, the information going projected into the cingulate gyrus. Extrinsic connection of the hippocampus. In the monkeys, the entorhinal and cerebellar cortex are in relation with the temporal polar area. The superior temporal gyrus, the posterior orbitofrontal gyrus, and the dorsolateral prefrontal cortex, the cingulate gyrus, and the retrosplenial cortex. The inhibitory transmitter is GABA. Modulators are noradrenaline, serotonin, and acetylcholine. And also main excitatory neurotransmitter is a glutamate. Also, there are presence of other peptides, including somatostatin, substance P, and enkephalin, histamine, etc. Clinical signs, when you have a problem of hippocampus, you can get the memory problem. The amnesia with studies of patients with neuropathologic findings always show an involvement of CA1 field and moderate antegrade amnesia and minimal retrograde amnesia. Involvement of CA1 to 3 and dentate gyrus or even entorhinal cortex gives moderate to severe anterograde and extensive retrograde amnesia. Kluver-Bucy syndrome is hypoemotionality, increased oral tendencies, visual of nausea, and modification of sexual behavior. This involves the circuit of puppets, and it occurs with the bilateral regions. The amygdala plays an important role in all emotional stimuli. The famous patient H.M. has been operated by Scoville on August 23rd, 1953, with bilateral hippocampal resection. And this patient was followed more than 35 years. The patient had a severe anterograde memory loss and preservation of the motor learning. In pathology, the limbic signs are observed in epilepsy with temporal lobe seizures, and memory and other deficit occurs in Alzheimer's disease, Lewy body dementia, Pick disease. Herpes encephalitis may also give specific lesion on the limbic lobe. Amygdala is located in the dorsal medial portion of the temporal lobe. It's in front and then above the temporal tip of the temporal horn. It is covered by a rudimentary cortex, including piriform cortex. There are two nuclear masses, corticomedial and basolateral. The basolateral is the largest with 3 components, including lateral, basal, and accessory nuclei. Extension of the amygdala goes also substantia innominata. The bed of the nucleus, stria terminalis, is linked to amygdala by stria terminalis. The corticomedial nucleus has 4 components. The anterior area of the nucleus, olfactory tract, is communicated to olfactory tract. Medial nucleus is communicated to amygdala itself, and then corticoamygdaloid nucleus. This is to show in axial plane, the large basal nuclei complex, and this is the lateral nucleus of amygdala, and the hippocampus is posterior to it. This is the drawing of amygdala, and here is the stria terminalis rising from the amygdala and then going into the anterior hippocampus. And this joins with the stria medialis. Interesting connections amygdala. The major connections arise from lateral and basal nuclei and terminate in medial nuclei. The GABA is a major transmitter, but also many other neurotransmitters are involved. Amygdala and subcortical connections, there have various connections with other systems like olfactory system, basal forebrain, related to the nucleus basalis of Minard. Also have ventral nucleus accumbens, ventral putamen, and the tail of the body and tail of the caudate nucleus. Also have a tight connection with the hippocampus, medial dorsal orbital frontal connection through the thalamus. Also have hypothalamic connections, and then ventral tegmental area of brainstem also have connections to the amygdala. The cortical afferents are from insula and the temporal, lateral temporal, and temporal pole. Also have anterior portion of the cingulate gyrus and the parahippocampal gyrus. Those are all cortical afferents to the amygdala. There is the subcortical afferents connection to the amygdala, the nucleus of Lafay, ventral tegmental area, locus cereus, and nucleus solitarius, all connecting to the as an afferent to the amygdala. The efferent from the amygdala is also diverse connections to the or hypothalamic nuclei and septal nuclei, and again the nucleus locus coeruleus nuclei of Raphe of the tegmental portion of the brainstem. Amygdala efferents to the cerebral cortex is mainly the prefrontal region and the insula and some of the parahippocampal fusiform gyri. If you stimulate the amygdala in animals, it causes reaction of rage and aggression, and in humans, it creates a feeling of fear, confusion, and amnesia. The stimulation of the amygdala also gives vegetative responses with increase of blood pressure, heart rate changes, and gastrointestinal motility, digestive secretion, and micturition. Unilateral stimulation of the amygdala can cause contralateral turn of the head and eyes, and complex movement of chewing, biting, and swallowing. Bilateral regions can cause hypersexuality in animals. Just talk about substantia innominata is the most basal forebrain groups, which is located in inferior portion of the anterior commissura. This includes the nucleus basalis of Maynard, or CH4 cholinergic nuclei 4. This is a very important structure that already discussed in the Alzheimer's disease. This is to show the nucleus basalis of Maynard. You look for the anterior commissura, the structure below the anterior commissura. This is the anterior perforating substance, which includes this nucleus basalis of Maynard. Olfactory tract and primary olfactory cortex are located in the basal portion of the brain, which is between gyrus rectus and the orbital frontal lobe. And the important connections are present between piriform cortex, which covers the amygdala, and the entorhinal cortex in the most anterior portion of the parahippocampal gyrus. Those are the areas connected to the orbital frontal cortex and also have a very intimate relationship with the olfactory bulb. This is to show the distribution of the entorhinal cortex. If you see the amygdala, hippocampal head portions, the portion of the parahippocampal gyrus, which is located in the most anterior portion, that is anatomically called entorhinal cortex. The arteries to the hippocampus is mainly vascularized by posterior cerebral artery and anterior choroidal artery. This anatomical specimen is showing that posterior cerebral artery, this is from the basilar tip origin, circled around at the midbrain, and then you can see here is the amygdala, the nuclei, and then hippocampus. We have a very abundant vascular networks coming directly from as a branch of the posterior cerebral artery. This is a sagittal section showing the hippocampus vascularized by PCA, and here is the anterior choroidal artery giving a branch to the amygdaloid nucleus, and then the portion of the hippocampus, and then this anterior choroidal artery is go to the choroid plexus. This is the posterior cerebral artery with direct branches towards the hippocampus. This is the end of the lecture. These are the references which contains a very detailed anatomy of the hippocampus and limbic system.